Congratulations on getting braces. Get ready to create the smile of your dreams. Yes, you. You play a major part in making sure that your treatment is effective. Let's get into home care. This is the home care kit that we give you. I'll go through everything that's in it. First, a regular toothbrush with a travel cover, a travel toothbrush. You get floss. This is called a Proxy Brush, a mirror in case you get curious, a timer to show how long you should be brushing your teeth, floss threaders, and wax. Now I'm going to go through and show you how to do all of the above. With braces, it's super important to take proper care of your teeth. Let's start with brushing. We want you to brush 3 to 4 times a day, so pretty much after every meal, breakfast, lunch, and dinner. You should be brushing for 3 to 4 minutes. We have a special timer here to help you. All you do is flip it over and wait for the sand to fall through. I also like to listen to my favorite song, which is about 3 to 5 minutes, making the time go faster. To brush, you angle your toothbrush at a 45-degree angle, brush underneath the bracket, above the bracket, and then of course on each side. Now this is only a fast-forwarded version. We also want you to get the chewing surfaces behind your teeth, your tongue, and of course your gums. You want to be very gentle when doing this. I also like to use this Proxy Brush every time that I brush. It helps me get the hard-to-reach places. To use this, I like to bend it, and I place it in between the brackets under the wire and use an up and down motion. Now be careful when you're doing this not to pull out because you could break a bracket or pull the wire out. Next is flossing. Flossing is super important for your gingival health, decreasing inflammation, infection, and bleeding. So you have your floss and your floss threader. You're going to guide your floss through the hole of the threader. Then you're going to take your floss threader, position it in between the brackets underneath the wire, pull it through, and then floss. You will do this to every single tooth. If this is something that you find difficult or your child finds difficult, we suggest investing in a water pick. Also in your new patient kit, you get one of these, Prevident Toothpaste. This is a highly concentrated fluoride toothpaste that we ask our patients to use at nighttime. Now this is prescription strength only. When you brush with this, you don't need a lot of it, but make sure that you coat all of your teeth. You spit out the bubbles, but you don't rinse. We want this to sit in your teeth all night long to protect from cavities and staining. Now this first one is complimentary on us. If you need another, they're for sale for $10 at the front desk. You may experience soreness or achiness when you get your braces on or after an adjustment. That's completely normal. We suggest that you eat or drink something cold and or take a common pain reliever like Tylenol, Advil, Motrin, whatever you would take for a headache. Another common thing is sores. If you start to develop a sore, you can always use dental wax. Let me show you how. When using dental wax, I suggest that you get the area as dry as possible. Rip off a small piece of wax, a little smaller than a pea, roll it in your fingers, get it warm, and then stick it on the bracket, the hook, or the wire that's bothering you. This creates a smooth surface to ease discomfort. I suggest taking the wax off before you brush and eat. If you do happen to swallow the wax, that is A-okay. Now that you have braces, there are some foods that you need to avoid in order to stay on track with treatment and to avoid broken brackets. We have 3 categories of food. First, no gum. That includes regular and sugar-free. 2, sticky and chewy foods. That includes Skittles, gummy bears, Tootsie Rolls, fruit snacks, etc. 3, hard and crunchy foods. We want to stay away from popcorn, hard pretzels, hard breads, corn chips and Cheetos, Takis, anything with nuts in them like trail mix, etc. Now there are a few foods that are an exception. Apples, we would like you to cut up into smaller slices. Raw vegetables like carrots, celery, and cauliflower, we would also like you to cut up into smaller slices. And if you're making corn on the cob, just cut the corn off of the cob. We don't want you guys biting into anything directly. If you do break a bracket, it's not an emergency, but definitely give us a call and notify us. We cover the first 3 broken brackets, but anything that exceeds that, we will begin to charge you $25 a broken bracket as an incentive to eat right. If you are to experience extreme pain, swelling, or a problem with your orthodontic appliance, please give the office a call. We do have doctors on call to always help you. If you have any questions or concerns, please don't hesitate to give our office a call. You can also refer back to this new patient success agreement that you'll be signing today. Again, congratulations on getting your braces on. Welcome to the Delaware Orthodontics family. We can't wait to see you soon.